we're going to do or demonstrate how to do a medication administration with the IV lock set. So first, I just did hand hygiene, put on a new set of gloves so everything's clean. I put the bed in a position of comfort, I put the rail down so I can work with the patient. I introduced myself. Hi, my name's Laura. I'm going to be your nurse today, Mrs. Edwards. We're going to be giving you a medication that's used to help with your CHF, to help with the edema, as well as your hypertension. It's called bumetadine, and we'll be giving that to you via your IV. If she has any questions at this time, we can further explain that to her. We start with checking our order. So we have our order from the doctor that says Mrs. Edwards is supposed to get the bumetadine 0.5 milligrams IV push over 60 seconds at 5 o'clock, which is the time that it is now. So we checked our order. Now we have to do some confirmation. So I'm going, ma'am, can you confirm your name and date of birth? Mrs. Edwards confirms that. I also checked the patient ID band that has her name, date of birth, and that she's allergic to penicillin. I again confirm that with the order that I have in the patient chart, which again says, confirms everything. So we used 2 forms of identification. We did a triple check. At this point, we know she's allergic to penicillin. We know it's her, date of birth, all of that. So now we have our drug, which is bumetadine. We want to make sure it's the right drug. We want to make sure it's the right dose, so it's 0.5 milligrams that we are supposed to be giving. This comes 0.25 milligrams per ml, so we'll be giving 2 mLs of this medication. At this point, it's the right time, so we know what time it is. Right route is going to the IV push, so we already have an IV established, so we'll give it through that. We also want to make sure it's the right patient, which we confirmed via ID band, as well as with the patient and patient order that this is Mary Edwards. And we're also going to make sure that we do the right documentation as well. So again, our medication is bumetadine. It's the 0.5 milligrams IV push over 60 seconds. So we need to know that this 0.5 milligrams has to go over 60 seconds. We do this so we can monitor if there's any adverse effects, because this goes straight into the bloodstream. So if we give it slowly and it's a nice slow push, we can see if any reactions happen so we can stop and treat that if necessary. If there were IV meds or solutions running, we would have to make sure that there's no contraindications or reactions between the medications, but since she has nothing running and we're only using the lock set, we don't need to worry about that today. So we're going to come over to the line before we do anything. We're going to look for any redness or swelling, if there was any fluids running, if there was infiltration, anything like that. Checking that, we're going to check the label to make sure we know when the IV was put in, so we know it was within the 96 hours, what gauge it is, which is your 20 gauge, and then we also have the initials of the nurse that put it in earlier. We also want to look if there's any skin irritation with the tape or anything for the IV securing device. So at this point, we're going to make sure that everything's ready. We're going to look at all our material, make sure that's good. We're going to prepare our medication. Like I said, it is 0.25 milligrams per ml, so we're going to need 2 mLs to meet the 0.5 milligrams. So we confirm expiration date, again, checking for right drug, making sure there's no expiration, making sure there's no particles or anything, right patient, anything we might need. So we have the bumetadine. It does have a safety cap, so we know that this is sterile and sealed. So we just don't want to, we want to make sure nothing touches that, so it stays sterile. We also have a 3 ml syringe, because obviously we have to get 2 mL, so we need to make sure that we drop enough. We have the tip on here that is covered, so again, this is all sterile. So once we open it, we need to make sure that it doesn't touch anything and that the cap is placed back on once we're done. So we have all of this. I'm going to do, before we do that, some hand hygiene. Make sure that that's all set, so we have clean hands when we're opening the meds. New gloves. So from this, like I said, nothing's touched this. This is sterile. Pop this off without touching anything. We have the cap to this. We still have our sterile gloves that we haven't touched with anything, so we can put that there. And we are going to draw up the 2 mLs. We're going to make sure when we're drawing up that there's no air bubbles or anything like that, because we want to make sure that we don't risk anyone for air emboli. Okay, so we have the 2 mLs. We're going to put that over there and recap this so that that needle stays sterile. You can put that down at this point. So again, hand hygiene, because we're going to start dealing with stuff. Again, new gloves are put on at this point. So now we're going to come over to the IV. We have some 10 ml flushes in order to make sure that the line's patent, as well as we can flush the rest of the medication through. So again, make sure it's normal saline, 10 mLs, because that's what's called for. We want to make sure that it's clear, no particulate matter, again, expiration date. The cover's on here so we know that it's sterile. So we can come over to the IV, we can unclamp this. If fluids were running, we would discontinue it at this time. We're going to take our alcohol prep pad, and we're going to take the port and wipe around this, all the threads, typically for about a minute. So we're going to continue doing that for just about a minute. Let it air dry. Don't let anything touch it. At this point, we're going to insert the flush. So we know that the flush hasn't touched anything, so we can remove the top. Again, nothing's touching this, keeping it sterile. So we're going to attach this to the flush, and then we're going to aspirate. So we're going to pull back to see if we can get some blood return. As you can see here, there's some blood return. We're going to push the 1 to 3 mLs to clean out the lock, just to make sure we don't have any resistance. If you do find resistance, make sure that the clamp is undone, as well as you never want to push through. So this is just to determine that it's patent and to make sure that we don't have any issues and that we can flush it easily, because we don't want to force that. So there's no swelling, no discomfort as we're doing this, which is what we want to see. So at this point, we've made sure that the line's patent, no swelling, no redness. We're going to discontinue this. We can throw that flush out. And now we're going to take another alcohol prep pad, and again, clean like we did before for roughly a minute, just to make sure that everything's sanitized the way it needs to be. We're going to let this dry. So now that it's air drying, you don't want to wave or anything like that. We're going to take our medication. So again, we know the dose of this is correct. We're going to double check this, make sure it's the 2 mLs, because each 1 ml is 0.25 milligrams, and we want 0.5 milligrams. So now that this is all set, we can DC the needle that we use to draw everything up. We're going to make sure that everything stays sterile and doesn't touch anything. This goes directly in our sharps container. We're going to use a needleless system just to make sure that, to prevent any injuries, and this is the system this hospital uses. So we're going to attach now that it's dry, everything's staying sterile. So we have that attached on. So now that our medication is attached on, we're going to administer a very small amount of medication. So we're going to do this in increments, a nice slow push. Again, this is to allow us to make sure if any adverse reactions are happening. So typically over 60 seconds we're going to do this. So for each 0.25, so each ml that you administer, you want to do it over 30 seconds. Typically, if you have a watch, it'd be a really good idea to use that. I'm not wearing mine, so I apologize that I wouldn't really use my phone, but I just want to make sure we're doing this over the right time. So again, we would make sure we monitor if there was a clock or something in here. So we're right about 30 seconds now, and we have about 1 ml in. There's no adverse reaction, so we're going to continue pushing. Remember, this goes right into the bloodstream, so we want to make sure that we're extra cautious to look for adverse reactions. And we're going to continue this until the entire dose is given over those 60 seconds. So again, 0.5 milligrams over 60 seconds, IV push. Okay, so we have the full amount in. We're going to disconnect the medications, dispose of that. We're going to take another alcohol prep pad, clean that port again for roughly a minute, and we're going to let air dry. While that's air drying, we can take our second normal saline dose. Again, we're looking at this to make sure it's not expired, that there's nothing particulates in it, that it's normal saline, everything we want through that. Again, it's covered, so we don't have to worry about that. We're going to remove it, make sure nothing touches this as well as the port. Once this is dry, we can connect this. Once that's connected, we can push 1 to 3 mLs to make sure all the medication is flushed through the lock set and that all the medications have been administered to the patient. Once we have that all set, we can discontinue this. We're going to clamp off. Dispose of your flush. We want to make sure that we clamp it off so that there's no backflow. make sure that we flush that to make sure, like I said, all the medications get in and make sure there's no occlusion of the IV. So now that it's clamped off, we've cleaned everything. We're going to make sure that we're continually looking for redness or swelling, make sure our patient knows that they need to continually check to make sure if anything's uncomfortable, what to look for as far as adverse reactions or anything like that. So we can discard all of our supplies at this point. We're going to perform hand hygiene. We're going to explain to Mrs. Edwards that we're going to put her back in a position of comfort, make sure she has her call light, make sure everything's cleaned up the way it needs to be. We're also going to start documenting appropriately. So we're going to go back and make sure we document that the medication was given, how much, what time, what route, if there were any adverse reactions, any other interventions, the appearance of the IV site to make sure that there's no redness, swelling, anything like that. If there was any pain, we can also include any teaching or education points discussed with the patient, and then we can continue reassessing and checking on her after that until our next medication is given.